I went into my family physician and I was black and blue. And he said, "What's happened to you?" And I said, "I keep fainting and falling." And he said, "I want you to see a cardiologist."
One of Dr. Heiser's partners, Dr. Willikis, was evaluating a patient who had severe aortic stenosis. Unfortunately, she also suffered a catastrophic fracture. Literally, she got up from a sitting position and fractured her leg.
I went to stand up, and I heard it go crunch, and it broke the kneecap.
She was also found to have a severely narrowed aortic valve, and the surgeons didn't want to fix her leg until this aortic valve issue was dealt with first.
"You're going to see the orthopedic surgeon." And we went to see her, and she says, "I won't touch you with a 10-foot pole until you get your heart fixed."
Because of her underlying comorbidities, Dr. Willikis thought she was at extreme risk for complications through a traditional surgical procedure. And that's how she ended up seeing us for entry into a percutaneous trial, which actually looks at replacing the aortic valve through a minimally invasive approach, entering an artery through the groin and placing the valve within the old valve, and thus she ends up with a new valve without even having to put her on a breathing machine.
When I first heard about CoreValve clinical trial, I knew nothing about it.
In the operating room, the valve actually was able to be placed exactly as we planned to do, so we were able to use an approach to place the valve through the femoral vessels, and so we didn't have to do any work in the chest itself. She had no complications requiring any other interventions. Sometimes patients do require that, but she did not, and actually the majority of patients do not require additional procedures. And she was also able to be done when she was awake, and so that just using sedation and local anesthesia, we were able to put this valve in. So at the end of the procedure, she was able to be transferred to the recovery room and was fully awake and didn't have to recover from the sometimes prolonged anesthesia that's involved with open heart surgery.
Within 2 hours, I came out going like this and eating a full meal. People had their appendix out, don't feel as good as I did. No pain. Nurses would say, "Don't you have any pain?" I said, "No, I have no pain whatsoever."
Remember, she had the fracture in her knee, and so by not having a prolonged recovery from this, because it was able to be done through a catheter, it shortened her recovery time and allowed her to get her second procedure in a very timely fashion.
So if the study came out that showed that if you actually help these people by putting in a new valve, they live longer, they feel better, and their quality of life improves. Ultimately, that's what this trial is going to address. That same question is how does it affect lifespan? How does it affect how the patient feels? Quality of life is a big question for us to answer, because at the end of the day, you want not only the patient to live longer, but you want the patient to live a happy and productive life.
My plans for the future are trying to lead a normal life instead of a handicapped life. The CoreValve has done it. I wouldn't be able to be here without that.